His name was Martin. He was 62, retired for 3 years. He walked into my clinic with a question that, honestly, many men ask even if they rarely say it out loud. He sat across from me looking a little uneasy and said, "Doc, I'm not sure if I'm doing it too much or too little." I smiled and asked, "What do you mean?" Martin leaned in, lowered his voice, almost like he was afraid someone might hear. "Well, how often should a man over 60 be intimate?" He hesitated, then added, "My wife, she's still very much into it. Sometimes I wonder, is it even safe to have sex that often at my age?" I could see real concern in his eyes. It wasn't about desire or performance. He was afraid of pushing his body too far. Afraid of disappointing his wife. Afraid of losing a part of himself that still mattered. I paused for a moment. Then I told him something I've said to many men since. Just because you still want it, doesn't mean your body is always ready. You have to listen, not just to your partner but to your heart. Literally. Martin's question isn't rare. In fact, it's more common than ever. As men live longer, feel younger, and want to stay connected with their partners, many are unsure where the line is between healthy intimacy and too much of a good thing. That's exactly why I made this video. We're going to break it all down, clearly, honestly, and based on real experience. We'll talk about what's normal, what's risky, and how to know if frequent sex after 60 is truly safe or silently harmful. And if you're over 60, or getting there, and you've ever wondered about your manhood, your limits, or what's still possible, then you're in the right place. If this sounds like something you, or someone you love, needs to hear, please like this video, share it, and consider subscribing. Because this might be the one place where a urologist finally tells you what no one else will. The truth behind frequency: there's no one-size-fits-all. There is no perfect number. That's the first thing I tell every man who asks me, "How often should I be having sex at my age?" It depends. On your heart. On your hormones. On your energy levels. On your relationship. And most importantly, on how you feel the next day. Some men in their 60s are running marathons. Others get winded walking up the stairs. So how could there possibly be one number that works for all of us? According to studies from the Mayo Clinic and Harvard, healthy men over 60 can have sex anywhere from 1 to 3 times per week without harming their health. But that's only if your body says it's okay. And that's the part most men ignore. I always say to my patients, don't chase a number. Listen to your body instead. Because the moment you start performing for the sake of ego, you stop paying attention to the signals that really matter. Let me share a story. Dennis was 64 when he came to see me. He had collapsed after sex. Not because of a heart attack, but because of exhaustion, dehydration, and elevated blood pressure. He looked me in the eye and said, "My wife still wants to be close. And I didn't want to disappoint her." And I told him, not every number is something to be proud of. Sometimes, doing more than you should is exactly what puts men in the hospital. That might sound harsh, but I've seen this more times than I'd like. Sex isn't just about pleasure. It's a cardiovascular event. Your heart rate goes up. Your blood vessels dilate. Your breathing changes. In a young man, that's normal. In someone over 60, especially with heart issues, it could be dangerous. That doesn't mean you stop having sex. It means you treat it like exercise. If you wouldn't jog uphill, you shouldn't be trying to prove something in the bedroom either. So what's the solution? Slow it down. Make it intentional. More connection, less pressure. Real intimacy isn't about how often, it's about how present you are. A lot of men feel ashamed to ask me these questions. They think it makes them look weak. But let me tell you something. Asking means you care. And caring is a sign of strength. You don't need to act like you're 25. You've already been there. Now is the time to love smarter, not harder. I've seen couples who enjoy intimacy 2 to 3 times a week, well into their 70s. And I've seen others who do it once a month and still feel completely fulfilled. The number doesn't define you. Pushing your limits might feel manly until your body pushes back. If I had to give a general guide, here's what I usually tell my patients. If you're in good health, active, no major chronic conditions, 1 to 2 times per week is safe and healthy. If you have heart disease, diabetes, or take medications that affect blood pressure or hormones, start with once or twice a month. Check in with your doctor regularly. If you ever feel lightheaded, short of breath, or deeply fatigued after sex, that's not normal. That's your body asking you to slow down. And here's something we rarely talk about. Sometimes the pressure to perform doesn't come from your partner. It comes from inside. From pride. From fear. From not wanting to feel less of a man. But let me be honest, you're not less of a man because you slow down. You're more of one because you care enough to stay alive and present. You see, real masculinity isn't about how many times a week you can do it. It's about how well you show up for your partner. And how well you protect your health so you can be there for the long haul. I remember Jack, a 67-year-old man who told me, "Doc, we only do it every couple of weeks. But it's better than anything I remember from my 40s. He wasn't joking. Because it wasn't about performance. It was about connection. It was about shared peace, not pressure. So, if you're asking yourself, how often should I be intimate at this age? Here's my answer. How often do you feel energized after? How often does it bring you joy, not stress? How often does it strengthen your bond, not weaken your body? That's your number. Nobody else's. And if you're not sure, men who ask live longer, love better, and regret less. After 60, sex isn't about proving something. It's about honoring your body, your heart, and the life you still want to live. And that, to me, is the most intimate truth of all. What's too much? Signs your body isn't ready. Let's be honest. Most men don't want to admit when something feels off. Especially when it comes to sex. We're taught to push through. To be strong. To never say no. But after 60, that mindset can do more harm than good. The truth is your body speaks. And when you ignore it, it doesn't whisper, it screams. So how do you know when you're pushing too hard? What are the warning signs that your body isn't ready for sex, or too much of it? Let's start with the first. A racing heart that won't settle down. Yes, your heart rate goes up during intimacy. That's normal. But if it stays high 20 to 30 minutes after you're done, that's not excitement. That's stress. That's your cardiovascular system saying, slow down. Second, shortness of breath that lingers. If you feel dizzy, like you need to sit down or catch your breath long after the moment's passed, that's a red flag. Third, insomnia. A lot of men think sex helps you sleep. And usually it does. But if you're wide awake, restless, or wired at 2 a.m., your nervous system may have been overstimulated. Fourth, temporary erectile dysfunction. It's more common than you think. If you struggle to get or stay hard the next day or for the next few days, it may not be performance anxiety. It might be fatigue. Physical burnout. Fifth, deep, unexplained fatigue. Not just, I need a nap tired. The kind of tired that lingers into the next day, the kind that leaves you sluggish, disconnected. I had a patient named Bruce. He was 66, healthy, sharp-minded. But he came to me one day and said, "Doc, I used to feel relaxed and light after sex. Now I feel wiped out. And even a little anxious." He thought it was just aging. But when we ran the numbers, blood pressure, testosterone, heart rate, he was clearly overexerting. And he wasn't recovering fast enough. Here's something most people don't realize. Sex uses up testosterone. And when you're over 60, your body doesn't replenish it like it used to. So pushing yourself too far, too often, can actually lower your testosterone even more. And what happens then? You feel moody. You lose energy. You sleep poorly. You lose interest in sex altogether. And worst of all, your body begins to fight what it used to enjoy. So yes, too much sex can backfire. Not just physically but hormonally. And here's what breaks my heart. Most men don't talk about it. They hide it. They're embarrassed. They're afraid of looking less manly. But I see the damage that silence causes. Every week. When sex leaves you more exhausted than fulfilled, it's no longer intimacy. It's a burden. And I say that with care. Not to scare you, but to protect you. Because I've seen men ignore these signs until they're in my office with heart palpitations, skyrocketing blood pressure, or worse, they just feel like they've lost something they can't explain. The truth? They didn't lose it. They burned it out. There's a myth in our culture that slowing down means giving up. But I tell my patients, you don't sprint through a marathon. You pace yourself. That's how you finish strong. Sometimes I feel genuinely sad, especially when men tell me they've been hiding these symptoms from their spouses because they're afraid of seeming weak. And you know what I say? Taking care of yourself is not weakness. It's wisdom. It's strength. And it's how you keep showing up for the people you love. So what should you do if you're seeing the signs? First, track your body's response. How do you feel the next morning? Energized or depleted? Second, talk to your partner. Explain what's going on. Sex should never feel like pressure. It should feel like partnership. Third, support your testosterone naturally. Eat real food. Get sunlight. Strength train, yes, even twice a week helps. And cut back on alcohol. It drains testosterone faster than aging does. Fourth, see your doctor. Get a hormone panel. Do a heart check. Know your numbers. Not to limit yourself, but to free yourself from guessing. You might discover that just a few tweaks, better sleep, better pacing, can bring your energy back and your confidence too. I'm not telling you to stop having sex. God, no. I'm saying, do it smart. Do it slow. Do it so you can keep doing it. And if your body is whispering that it's tired, please don't wait until it's screaming. Because after 60, intimacy should heal you, not wear you down. It should build you up, not break you apart. That's what I want for every man who walks into my clinic. And that's what I want for you. Is frequent sex dangerous for seniors? Let's talk about something most people avoid. The risks. Is frequent sex dangerous for seniors? The answer, like most things in medicine, is, it depends. Let's begin with the heart. Sex is not just emotional. It's physical. And for your cardiovascular system, it's essentially a mild aerobic workout. Your heart rate rises. Your blood vessels expand. Your blood pressure can spike, especially during orgasm. Now, if you're healthy, that's usually not a problem. In fact, it can even be beneficial. But if you've had coronary artery disease, irregular heart rhythms, congestive heart failure, or uncontrolled high blood pressure, then yes, the added strain might be risky. One study from Harvard Medical School showed that the risk of heart attack during sex is low, roughly 1 in a million. But those numbers only apply if your heart is already stable. And that's the key. Stability before activity. Just like with exercise. You wouldn't run a 5K race after a night of bad sleep, no water, and an empty stomach. Why would you jump into sex without preparing your body first? That means, eat right, sleep well, take your medications, stay hydrated. Your body performs best when it's respected, not rushed. I had a patient named Paul. He was 70 with type 2 diabetes and mild hypertension. One morning after sex, he experienced chest pressure and nausea. His wife thought he was just tired. But it turned out to be atrial fibrillation, an irregular heartbeat. He didn't go to the ER because of sex. He went because he skipped his heart meds the day before, stayed up too late, and hadn't eaten anything since lunch. It wasn't the act. It was the neglect. And that's what I want to emphasize. It's not sex that kills men, it's the way they ignore their health that becomes the real danger. So is it dangerous? Not if you treat it like what it is, a physical event that deserves preparation. Think about your lungs too. Men with asthma, COPD, or sleep apnea may feel short of breath during intimacy. That doesn't mean you stop. It means you pace yourself. Choose positions that support your breathing. Use extra pillows. Communicate. Sex should make you breathe deeper, not make you afraid of breathing at all. Now, what about stroke? It's a concern I hear often, because during climax, blood pressure can surge. And for those with uncontrolled hypertension, that surge could trigger a stroke. But here's the good news. Multiple studies show that regular, moderate sex helps regulate blood pressure over time. It improves the elasticity of blood vessels, enhances circulation, and lowers stress hormones. So in a healthy setting, frequent intimacy actually helps prevent strokes, rather than cause them. And here's something even more fascinating. Sex supports your brain. Yes, frequent intimacy slows neurodegeneration. A study from Coventry University in the UK found that adults over 60 who had regular sex scored higher on memory, language, and attention tests. Why? Because sex boosts dopamine and oxytocin, two chemicals vital for brain health, bonding, and emotional resilience. It also lowers cortisol. And when cortisol drops, your brain performs better. You sleep deeper. You think clearer. So the benefits are real, if you approach it wisely. What do I mean by wise? Don't treat it like a performance test. Treat it like a shared experience. Don't chase numbers. Chase connection. Too many men try to prove something. To themselves. To their partners. To their past. But listen to me clearly. Frequency means nothing if it leaves you fatigued, fearful, or disconnected. You want consistency, not chaos. I often tell my patients, sex is like swimming. It refreshes you if you know how to float. But if you fight the current, you'll drown in exhaustion. Let me be practical. Here's what I advise. If you have stable health, 1 to 3 times a week is fine. If you have chronic issues, start slower. Maybe once a week, or even twice a month. Focus on pleasure, not pressure. Take care of your body like an athlete would. Eat healthy fats. Stay active. Stretch. Rest. And always ask, do I feel better after sex? Or do I feel depleted? If it energizes you, you're doing it right. If it drains you, something needs adjusting. And please, talk to your doctor. Not just about heart meds, but also about testosterone, fatigue, sleep quality. It all connects. Sex isn't isolated. It's a reflection of your total health. And that's the beauty of it. Because when you feel well, sex becomes a celebration, not a struggle. So no, frequent sex isn't dangerous for seniors. Uninformed, unprepared sex is. Get informed. Be honest. Prepare wisely. And you may just discover that this chapter of life, when done with care, might be the most satisfying of all. The intimacy equation, physical health plus emotional bond. Most people think intimacy is all about performance, about strength, stamina, and physical ability. But the truth is, for men over 60, intimacy is just as much about the heart as it is about the body. And I don't just mean heart health. I mean emotional closeness, connection, that feeling of being seen and cared for. Because in my experience, many men who are still physically capable of having sex lose the desire not because their body failed them, but because something else is missing, something deeper. I've had patients tell me, "Doc, everything still works, but it just doesn't feel exciting anymore." And when I ask them, "How's your relationship outside the bedroom?" they pause, they hesitate, and then they say something like, "We're kind of distant these days." That distance, that emotional silence, can shut down desire faster than any medical condition. Because sex is not just about blood flow. It's about emotional safety. It's about trust. Real intimacy doesn't begin in the bedroom. It begins at the dinner table. In the way you ask how your partner slept. In the warmth behind a passing touch. I've met couples who haven't had real conversations in months. They live in the same house. They share meals. But they've stopped sharing their hearts. And when the emotional connection fades, the physical follows. You might still want it. You might still try. But something's missing. And your body knows it. That's why I always tell my patients, before you ask how often is enough, ask how open is your relationship right now. Because sometimes, the issue isn't testosterone. It's loneliness. It's unspoken resentment. It's fear of being rejected or misunderstood. And here's something I want you to hear. It's okay to feel this way. You're not weak for needing connection. You're human. And after 60, that need becomes even more important. I remember a couple, Tom and Linda. They were both in their late 60s. Tom came in concerned about his lack of drive. When I spoke to Linda, she admitted they hadn't had a real heart-to-heart in years. I don't even know if he still finds me attractive, she said. And Tom? He thought the same thing. They were both waiting for the other to reach out. Both silently afraid. Both still deeply in love. They just needed to talk. And once they did, things began to shift. Not overnight, but slowly, gently. They rebuilt their bridge. And the intimacy returned. Not like it was in their 30s, but more honest, more grounded. You don't always need fireworks to feel close. Sometimes the quiet flame is what keeps the room warm. If you're over 60 and you're feeling disconnected, start with presence. Start with eye contact. Start with listening. Say what you feel. Ask what they need. And be patient. Touch doesn't always need to lead to sex. Sometimes just a gentle hand on the shoulder says, I'm here. And sometimes that's exactly what your partner needed to feel wanted again. You can take every supplement in the world. You can have perfect laps. But without emotional connection, intimacy will feel hollow. So yes, physical health matters. But emotional connection is the multiplier. It's what turns moments into meaning. I always remind my patients, before you worry about how many times a week is enough, make sure your heart and hers are still speaking the same language. Because when they are, even once a month can feel like magic. And when they're not, even every day might feel empty. Intimacy is not a number. It's a language. And the best part? You can learn to speak it again, at any age. My final advice, what I tell my patients. If you've made it this far, let me speak to you directly. You're probably not here because you're desperate. You're here because you care. Because you want to stay healthy, connected, and confident. Not just for yourself but for your partner too. So here's my final advice. Not just as a doctor, but as a man in his 60s who's walked this road with thousands of patients. Don't chase numbers. Don't compare yourself to younger men, or to your younger self. Instead, ask real questions. How do I feel after intimacy? Do I feel stronger or weaker? Do I feel closer to my partner or emotionally distant? Do I feel alive or just obligated? Because your answers will guide you better than any medical chart ever could. If you're healthy with no major conditions, once or twice a week might be just right. If you have chronic health concerns, maybe twice a month is enough, without guilt. And if you're not sure where you stand, start by checking in with your body. And yes, check in with your doctor. Run a hormone panel. Get your heart assessed. Ask about sleep, stress, and mood. Because sex is never just about sex. It's a mirror of your lifestyle and a barometer of your emotional world. So improve what's behind the scenes. Eat nourishing food. Sleep deeply. Move daily, even gently. Lift something heavier than a remote. And get sunlight on your skin. Those habits matter more than any pill. But more than anything, nurture your emotional bond. Talk to your partner. Even if it feels awkward. Especially if it does. Hold her hand. Tell her what you're afraid of. Tell her what you still desire. I had a patient, Ron, 68. He hadn't been intimate with his wife in over a year. He blamed his hormones. His wife blamed herself. When we finally sat down together, I asked them to talk, to really talk. And what followed was silence, then tears. Then a moment of honesty that changed everything. 2 months later, Ron walked back into my clinic with a smile. He didn't talk about sex. He talked about laughter. About feeling seen. About holding hands again. Sometimes the fire doesn't come from the body. It comes from finally being understood. So don't overthink frequency. Think about connection, about energy, about recovery, about feeling safe. Because the men who enjoy intimacy the most after 60 aren't always the fittest. They're the ones who stay honest, who show up, who soften instead of harden. And if you're still struggling, don't stay silent. See your doctor. Start the conversation. You might be one question away from getting your life back. Growing older doesn't mean losing love. It means learning to love better. And intimacy, when done right, isn't a sign you're still young. It's proof that you're still alive, still here, still capable, and always still worthy.